Good afternoon, the chairman of the occasion. Good afternoon, everybody represented here. All protocol duly observed. My name is Onyeka Achigo, representing Nemel Pharmaceuticals. Nemel, we are an indigenous company operating in Enugu here. We have about 78 range of products and all are produced indigenously. So today, we have come to present our cardio ranges from Nemel Pharmaceutical Limited. So as I told you that we're indigenous here, we are located in MNA. And as I told you, we are into drug manufacturing, research and development oriented. We have staff strength of about 150 employees. We have our objectives to support the actualization of health-related goals in African Union Agenda 2063 and SDG 3 to reduce mortality and mobility through the production of cost-effective pharmaceutical products driven by cutting-edge research. On that note, what I want to present to you today, I don't need to begin to explain types of cardiovascular because I know the people that I'm here with. We know that studies show that 17.7 million people die every year from cardiovascular diseases. That's about 31% of all global deaths. And 1.1 billion adults have raised blood pressure less than 1 in 5 have it under control. What we did in our cardiovascular ranges was the use of clotalidone. Clotalidone, by our brand, is known as Cypress. And clotalidone, a thiazide-like diuretic, that's what we use. And after that, we now combined several other products. We know one of the products or generics we use here commonly in Africa in diuretics is mostly hydrochlorothiazide, but we now found that clotalidone, being a thiazide-like diuretic, is more effective and potent than the hydrochlorothiazide. And because of that, we brought it to Nigerian markets, seeing the potency. On that, let me emphasize more on clotalidone as a sulfonamide derivative that acts in a similar fashion as thiazides. That's why we call it thiazide-like diuretic. So clotalidone is considered first-line therapy for management of uncomplicated hypertension. And why I have to emphasize on this, let me talk a little about hydrochlorothiazide. Between hydrochlorothiazide and clotalidone, clotalidone as a thiazide-like diuretic, why clotalidone is, these are two old drugs that are all very useful and still useful in our although similar, they differ, but an important way that is still not fully appreciated. That's why clotalidone is more potent than hydrochlorothiazide in lowering blood pressure. Several studies also have shown that clothalidone at the same dose as hydrochlorothiazide is 1.5 to 2 times potent. So what we did was, if you want to compare this hydrochlorothiazide and clothalidone, we discovered that duration of action of hydrochlorothiazide is about 6 to 12 hours, but in clothalidone, we have about 48 to 72 hours. And also, when you talk on the elimination half-life, we have about 10 to 12 hours of hydrochlorothiazide, but in that, we have 40 to 49 hours obtained in clothalidone. So it has been shown that clothalidone has been shown to have a number of pleiotropic effects that differentiate it from other diuretics, just like this hydrochlorothiazide. It decreases platelet aggregation and vascular permeability. It promotes angiogenesis in vitro. So what we're saying is that what we found on this clothalidone, we made it and combined it with other generics used in management of hypertension. Like we have amlodipine, semisartan, and that's why we came out with our ranges. And we have, like if you look at the back of your program, you will see those of our ranges. At the back page, you will see those of our ranges. And that's why the Cypress, our clothalidone, we combined it with, we have densivin, which is amlodipine, semisartan, and the clothalidone, 12.5 milligram. In the densivin, we have 5 milligram of amlodipine, 40 milligram of semisartan, and 12.5 milligram of clothalidone, because we believe that a low dose of all this combination will give about 75% of what you are aiming at in your patient. So we also have a combination called Mediran. We have Cotripine. So on this, while we have densivin of 40 milligram of semisartan, 5 milligram of amlodipine, and 12.5, we also have a higher strength of that. In that case, we have semisartan 80 milligram and amlodipine 10 milligram, and the same dose of 12.5 of clothalidone. In Mediran, we have semisartan 40 milligram and clothalidone 12.5 milligram. Then we also have Mediran Fort. The Mediran Fort is 80 milligram of semisartan and 12.5 milligram of clothalidone. Then we have Cotripine. Why we did this? Why we have the triple combo? We have the dual combinations. The dual combinations, because we also believe that with this combination, we leapfrog for a very effective management of patients with high blood pressure. So on this, in my slide, you discover that about 25% need monotherapy, 50% need dual therapy. So about 25 need 3 or more combination. And this is why we should endeavor to use our combination cardiovascular drugs It is cheaper. It can be complied because patients find very comfortable taking only one pill, but not when you have about 3 of the pills that you are, but instead you just take one and the compliance is achieved in the patient. So recent guideline recommends initiating treatment with 2 drugs in those patients with a systolic blood pressure greater than 20 milligram mercury and or diastolic pressure greater than 10 milligram mercury above the goals. And in those patients with high cardiovascular risks, therapy with a single blood pressure in the medication forced to reach goal to 75% of the time. Approximately 25% will require 3 antihypertensive agents to achieve the therapeutic targets. So this is our ranges: tensiven, amlodipine 10, I explained earlier, temesartan 40 milligram and 12.5 milligram of clothalidone. So this is our Mediran, 40 milligram of temesartan and clothalidone 12.5 milligram. So on that too, we have coltripine, amlodipine 5 milligram, temesartan 50 milligram. Then we have the one we call coltripine Forte. It's still at that back page of our program. So I beg all of you to please use our NMA cardiovascular range of products because they are very cost-effective, customer and patient-friendly, readily available, and anytime you call on us, we always deliver. And we are indigenous. We are probably Nigerians. So my brothers and sisters, please, with the mayor, we thank you immensely. And we are very proud that we are partnering with you. We are at the backstage there. Please, we beg to patronize us so that we can continue to partner with NMA and support NMA. Thank you very much.